Hi, I'm Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. And today I will help you understand how gene therapy for hair loss can help you rejuvenate your hair and stop hair loss, maybe even forever. Currently, science has reached a level where I can very confidently say that 5 to 10 years from now, at most, we will be having a vaccine against male pattern baldness. That is, you will be able to control your gene expression at will and be able to decide that whether you want to turn bald or you do not want to turn bald. It will not be an inevitable thing as it is now. And this will happen without any CRISPR-aided gene surgery or any editing or addition of genes. So what does it involve, and why is gene therapy for hair loss so important for you today? Right now we are at a stage where we have reached a level of understanding why we are losing hair due to our gene expressions, not because of testosterone or DHT, and how we can control it or modify it. So before radical gene therapy happens, we have the baseline gene therapy in place. That is what I am going to help you understand. It is much like anti-aging treatments of today. The radical anti-aging treatments which will help us live young for a long time are going to come. But right now we have understood how we can modify and how we can keep our body healthy. Similarly, now we have understood how we can keep our hair young, healthy and growing and prevent baldness for a long period of time till radical gene therapy comes. So I'm going to talk about that today. It is also important because if we lose all the hair that we are going to lose to male pattern baldness, then when the radical gene therapy comes, there will be nothing left for it to revive. So whatever hair you have, we have to try to hold on to that hair, strengthen that hair till such time comes. Reviving is always easier and safer than putting some extraneous stem cells or stem cell made hair follicles into your head. They will always carry or may possibly always carry a risk of cancers, and as a result may take a long time for such an approach to be approved. Whereas today the knowledge that we have about changing gene expression does not really pose any dangers. These methods are quite safe. These molecules are quite safe. They have been researched a lot. So go ahead and read about that. So first step would be reading about the science of epigenetics. Epigenetics has helped us understand how we can change the expression of our genes for a long time safely. Today we are living in one of the most dangerous times. There is pollution all around us. We lead a very sedentary life. We do not stress our body at all. And most of the time we do not eat or breathe what is good for us. This is not the best condition for maintaining our hair growth. We are also noticing that we are losing hair at a younger and younger age. If you see the generations, you will find this. The dangers to our body are very evident when we see or hear news of people getting heart disease, diabetes, thyroid problems, and various other conditions at a very young age nowadays compared to the previous generations. Similarly, I notice in my own center people getting hair loss at 20. I see many patients coming at 20 years of age with a full-blown Norwood 6 level of hair loss. And when I tell them that hair loss or male pattern baldness is genetic, one of the commonest replies is that yes, my father did turn bald, but he turned bald way later than me, maybe when he was 35 or even 40 years. Why am I getting bald at 20? So if it is genetic, then why am I not losing hair at the age when my father lost it? So the answer lies in the epigenetics. If our genes were to say that we are genetically born to be bald, then why are we not bald when we are born? Is there a clue there? Yes, we are born at that time, our eye color, there is a gene for that, is determined, and it remains static throughout our life. But the genes of our hair loss, they are dormant. That is the best way to understand. They are in a sleep mode at the time of our birth. And we, by our actions and the way we live and whatever happens to us, we decide when to turn on that epigenetic switch, which switches on the hair loss process, and then the stem cells of the hair follicles slowly start dying or escaping or not being able to multiply properly. And that is when we see the hair becoming shorter and shorter, and ultimately we notice baldness. So that explains why we are seeing hair loss or baldness at a younger and younger age. This is also the basis of my epigenetic theory of hair loss. That is, let us forget the simplistic way of saying that testosterone leads to DHT, which causes our hair loss. That way, we should have been bald when we were 18 years of age. That is the time when we have the highest levels of testosterone. It does not happen. But whenever I ask a patient, what happened? When did you lose hair? They come up with specific events. For example, when they went from home to hostel, college to study, or when they changed job, or when they pass through a very stressful period in their life. Suddenly they notice a lot of hair fall, and we as doctors had been sidelining or neglecting this epigenetic event. We are losing hair at a younger age because we are switching on the gene for hair loss at a younger age by spoiling our epigenome. So, how do we spoil our epigenome? Let's understand in a simple way. An easy way to understand hair loss: our hair follicles or hair roots have stem cells. Stem cells multiply. If they multiply properly, we get good growing hair. If for any reason the stem cells slow down their multiplication, then we have thin miniaturized hair or a lot of hair fall. And if when they stop multiplying totally, then there is hair loss. So if you feed the stem cells properly, if you nourish them properly, you take good care of them and give them good signals, they will keep multiplying. On the other hand, if you do not take care and if you do not nourish these hair, if you starve them, then you will have premature baldness also. So when you have a acute illness like the COVID or any severe illness for that matter, or go on a crash diet, or if you go for a totally wrong lifestyle also, then you starve your stem cells, you damage them from your side. This causes hair fall and hair loss. And this is a common answer that you get when you ask the patient, what do you think caused your hair loss? So they will mention a change of place or a change of diet or a very stressful period. For example, when children go to hostel or college around 17 to 19 years of age, that is the time when there is a severe change in diet. The person stops his or her ancestral diet, the good, rich, nutritious diet which one gets at home, and starts off on a dormitory meal or a hostel meal which is definitely no comparison to a home meal. Also, there are a lot of wrong lifestyle choices at that time. Going through extreme stress, anxiety, worry, all of these contribute, and we'll see how all of them contribute to hair fall. A change in environment also takes place. Change of water, change of the pollution levels if the person goes to another city. All these are contributing epigenomic factors. So let's consider these 5 things: the food you eat, the things you drink, the air you breathe, whatever you apply on the skin, and the hormones produced in your body, whether in response to stress or otherwise. Molecules absorbed from all these things ultimately end up in your blood, and blood takes them all over your body, including to the places around your hair roots, from where these things reach your stem cells or the vicinity of the stem cells. Now, just like in case of a person, if the environment is bad, he will get ill. Similarly, in case of stem cell in the hair follicles, since they are rapidly multiplying cells, lack of nutrition and nutrition being replaced by toxins will cause them to severely stop their healthy multiplication, to escape from the hair follicles, or to in general wither out. So like in PRP, the growth factors are made in body. Similarly, the things which we are eating are contributing to making of those growth factors. Our hair follicles are the fastest multiplying organ or fastest growing organ of our body. So the moment any toxins, preservatives or chemicals which are damaging reach these stem cells, they are affected in a negative manner, but only in people who have a genetic predisposition to hair fall, meaning in people or in hair follicles where the stem cells are not permanent or lifelong surviving stem cells. Where the hair follicles contain permanent stem cells, those are not affected by these factors. These all are called the epigenetic factors and constitute your epigenome. When I say that a person spoils his epigenome, it means he does all the wrong things in response to all of these 5 factors. Leading a stressful life, living in a polluted environment, staying up late at night and full of anxiety causes a lot of cortisol production. Eating junk food and food not containing proper nutrients, and even fast food or food containing a lot of preservatives like ready to cook meals or pre-made meals. All of them cause damage to the hair, and this is what is your epigenome, and this is what is going to affect your genome. So just as you can slow down your hair growth or increase your hair fall by spoiling your epigenome, you can reverse the process also by turning your epigenome healthy. I'll give a quick short example. Imagine you have a twin. If you follow all the correct methods, eat all the healthy foods, live a good lifestyle, whereas your twin, he eats all junk food from morning till late night, doesn't sleep on time, follows a bad lifestyle. So tell me, who will lose hair first? Your twin, naturally, because he has a worse epigenome than you. So if genome is your car, then epigenome is the driver. Till now we did not know that such a driver exists. So we did not know what to guide it towards. Now that we know that there is an epigenome, we can accordingly modify or correct our epigenome to prevent premature hair loss and also to keep our hair healthy and for growing for the longest duration. So here you are in a situation where you have a genetic predisposition to lose hair, but because of the wrong habits and wrong lifestyle, you are losing hair at a younger and younger age. So my suggestion is that you follow the proper hair care process as I have outlined. It stresses a lot on correcting your lifestyle. It includes intermittent fasting, eating the correct supplements and the correct diet, following a good sleep protocol, exercising regularly, taking cold water bath, breathing exercises, and a lot more. All of that will improve your epigenome, and you will see a lot of benefits in your hair as well as in your entire body. Along with this, you initiate the basic gene therapy for hair loss that I advise, which includes positioning these molecules like resveratrol, grapeseed extract, fisetin, alpha-ketoglutarate, NMN, nicotinamide mononucleotide into your skin in vicinity of your stem cells. So how do we do that? We do that by using a derma roller or a derma pen or a derma stamp. So you use a derma roller of at least 1 millimeter needle points. If you have a thicker skin, you can go up to 1.5 millimeter also. Once you roll the derma roller in an area where you have thinning hair, you will notice pinpoint bleeding. If you do not notice pinpoint bleeding, that means you are not pressing enough. The holes or channels which are being made are not deep enough. So then you take a longer needle. Maybe not 1 millimeter, use a 1.25 or a 1.5 millimeter. So the cutoff point is where you notice pinpoint bleeding whenever you use the derma roller. Derma roller is to be used once a week. You wet the hair and then use the derma roller in a manner that it does not damage your existing hair. I normally teach each and every patient how to use the derma roller in the correct manner. After that, when you come to me, I of course apply the PRP growth factors also. I use astragalus, fisetin also, alpha-ketoglutarate also. In future, we will be using peptides like BPC, that is body protection compound, and follistatin. But at home, when you are doing this process, which I call the home use gene therapy session, that time you use the derma roller followed by application of resveratrol grapeseed serum. Resveratrol and grapeseed serum are very safe, without any side effects and natural products. These you can use, and you should use it every day. So once a week, I'll repeat again, once a week you do the derma roller, apply the derma roller in the area where you have thinning hair or weak hair. Then you apply resveratrol grapeseed serum every day. You can apply it at bedtime and wash it the next morning. So these are really wonderful molecules. What you will notice within 2 months is slowly getting stronger hair. You will notice less and less hair fall, less hair in your comb or brush, on your towel, on your pillow, and your hair will become stronger, meaning when you pull them, you should not get too many hair in your fingers. And finally, you will notice thickening of the hair. Normally, we see that in the front rows where it is highly visible. What happens at a genetic or a cellular level is that resveratrol protects the stem cells from oxidative stress and it lengthens the telomeres. Remember, telomeres are located at end of the chromosomes and they keep on getting shorter and shorter. Most likely, a bad epigenome hastens the demise of these telomeres. When the telomere become too short, the DNA cannot replicate or multiply, and as a result, the stem cells cannot multiply, and therefore you notice hair fall. When you apply resveratrol, the telomeres lengthen. Once the telomeres lengthen, then it signals the stem cells to start multiplying again. Resveratrol has been shown to do this by increasing the gene expression of TERT. TERT is telomerase reverse transcriptase. So this is a very logical and scientific process. It is not like the old medicines where we usually say that we do not know why they work. Here we know why they are working, and I have explained in detail how you should improve your lifestyle, improve your nutrition, and you will notice a positive effect. Couple it with these gene therapy molecules, and that will lead to healthy hair growth for a longer duration. And my aim is that you retain your hair for the longest possible time, or at least till radical gene therapy comes. Because if you do not have any hair, even the thinner, shorter hair, then what will radical gene therapy be able to do? It will not be able to regrow hair dramatically out of nowhere. All of these beneficial effects you will notice in the first 2 months of starting the gene therapy for hair loss. So that is all I am asking you to do. Keep good care, take good care of your body. And now that you know how you can take care of your hair beyond applying oil to it, so start doing that for your hair also, and start this simple method of transporting these good beneficial molecules into the dermis or into your skin so that they can also protect your stem cells, nourish your stem cells, and signal them to start multiplying once again by elongating their telomeres and providing them the required energy to multiply, or NAD to multiply. Grapeseed serum, for example, and NMN, nicotinamide mononucleotide, they increase the multiplication. They are NAD precursors. They provide more energy. So follow this logical course, and if you have any questions, do remember you can ask me. Even if you are not my patient, if you have not got transplant done from me, I'll be happy to help you out. If you want your doctor to learn these things, please let him know. We are very open to cooperating with doctors world over, and if they want any of these serums or anything, we can supply it to them. We are very open to teaching other doctors about this radical and the basic gene therapy so that they can offer it to you. Follow this simple method, keep a healthy hair, and that is the gene therapy for hair loss explained in a simple language. Do remember to share this with the maximum number of people. Do subscribe to this channel, like and share this. Thank you.